And let's bring in Dr. Isaac Bogoch, the infectious disease specialist. Doctor, thank you as always for joining us.
My pleasure, Roger.
This is the first death from measles in more than a decade. I've heard even possibly in 25 years, because the records only go back about 10 years. Thankfully, it's rare, but is this concerning?
It is concerning, and obviously it's tragic. Anytime anyone dies, it's obviously tragic, but especially we're talking about a child, and we're also talking about vaccine-preventable illnesses. And it's also important to remember, too, that while this happened in Ontario, there are over 130,000 deaths per year related to measles on the planet. And again, the vast majority of those are in children, and the vast majority of those are preventable. We have a safe, free, widely available, and very effective vaccine. And we really need to work not just in Canada, but also globally to mobilize that vaccine to make sure that everybody who needs it has an opportunity to get it.
And of course, we know that the child was under the age of 5 and not vaccinated, but they could have been young enough that they might not have been ready for the vaccination yet.
Yeah, it's a great point. Typically, the first dose of a measles vaccine is given at the age of 1. But for families that are traveling abroad, especially to areas where there's a lot of measles transmission, that first dose of a vaccine can be bumped up to as early as 6 months. These are just conversations parents and families can have with a healthcare provider. And I know the answer to that as well. Some people don't have access. In fact, a lot of people don't have access to a family physician. And unfortunately, that's a sad state of affairs we have in Canada that needs urgent attention. But you can go to other places as well, not just a family physician. There's certainly public health clinics across the country that specialize in vaccinations, especially routine childhood immunization. You can speak with pharmacists, nurses, nurse practitioners. So there's a lot of different healthcare providers that can discuss this with families about routine childhood immunizations and when the right time is for these.
Is that something that should be considered, maybe moving it up to 6 months?
No, that would be under extenuating circumstances of travel to an area of high measles transmission. And in fact, if that first dose of a measles vaccine is moved up to 6 months, based on how a child's immune system responds to vaccines, it would almost be as if that would be ignored. So they would also receive another vaccine at the first year of life and then another vaccine before the child entered school. But it certainly can be done. And this is a conversation that families have with a healthcare provider to see if it's the right move for them.
And now, of course, the other concern is the fact that if it was a slightly older child and the parents may not have wanted to get them vaccinated, that is a growing concern right now, isn't it?
Absolutely. And in fact, we take a step back and look at the many reasons why people are not up to date on vaccines. We can't ignore misinformation and disinformation, often amplified in online settings, such that when people are presented with the option for vaccination, some people are choosing unwisely not to vaccinate themselves or their family members. And that's a huge problem. We also can't ignore the significant disruptions in many public health programs during the course of the pandemic. And some people might just have missed the routine childhood immunization. So many of the public health units across the country are really doubling down on their efforts to have strong community outreach, pop-up clinics, information sessions, et cetera, to really ensure that everyone knows what the routine childhood immunizations are. And then lastly, it's important to lower barriers to vaccinations, make it easy for people to get these, make it easy for people to understand what they need, and then bring vaccines to the people rather than bringing people to the vaccines with pop-up clinics, with good hours, with ensuring there's multiple places to receive these vaccines.
Is this something maybe can pharmacists offer the measles vaccine or not yet, right?
No, it's offered in many places. A lot of this is going to be dependent on the various province that people are working in. We often like to think that Canada has a healthcare system. We don't. We actually have 10 or more different healthcare systems in the provinces, and then of course in the territories, and even within the province, we have a hospital-based healthcare system. We have an outpatient system. We have a long-term care system, and those systems don't really interact all that well with each other. And there are clearly system level issues that are have been attempted to be ironed out for decades, and there certainly is room for improvement in how people access routine care and how public health services are delivered.
And what should people be looking for? I mean, because it is rare. I think we've had 22 cases this year. It's not something, with the exception of the actual red rash, it's not always easily recognizable. What should people be looking for?
I mean, the key here is, like, many clinicians and many people in Canada have never seen a case of measles. So you have to have a high index of suspicion. Here's the problem, is that there's such a large global burden of measles now that people who are under-vaccinated or unvaccinated in Canada that travel abroad have a higher probability of being exposed and bringing this back home, or people just traveling from outside of Canada coming to Canada have a higher probability of bringing this in. So this problem isn't going to go away. We're going to see imported cases for the foreseeable future. So we really have to be aware of what measles looks like. And usually after about a 10-ish day incubation period, there's non-specific symptoms: watery eyes, runny nose, bit of a cough. But then there's this classic head-to-toe rash. As you see photos and pictures right there on the screen, there's a classic rash that's associated with that. But in someone who's vaccinated, again, the vaccine's amazing, but it's not 100% perfect. You can have some mitigated symptoms and atypical presentations in vaccinated individuals, and the clinician should have a high degree of suspicion when we're seeing cases like that.
And who are we seeing with most of the cases? Is it adults who missed their vaccinations or didn't get it as a child? I actually went and got the blood titer done because I couldn't remember. My sister and I couldn't remember if we'd had a vaccine or not years ago, and it turns out we have it in our system. But is it adults that are bringing it in, or is it young unvaccinated children?
It's mostly the younger group. So typically people born before 1970 had a measles infection and have recovered from this and presumably have significant immunity. So it would really be in people born after 1970 who are either unvaccinated or undervaccinated. That's who we're seeing it in. And the epidemiology in Canada is really the younger cohort, the younger children. And most of these cases, not all, but the vast majority of these cases are travel-related cases where people have traveled outside of the country and been exposed to this, and then close contact of those travel-related cases. That's what we're seeing. And sadly, that's kind of what we're going to continue to see. There are pockets of under-vaccinated communities in Canada. So if you bring a case of measles, which is pretty much the most transmissible infection we have on the planet, and you have a case of measles that's in an under-vaccinated cohort or community, it wouldn't be surprising if we see onward transmission in the country. And this is why we just have to double down on our efforts to make sure everyone's up to date on their routine childhood immunizations to prevent subsequent transmission in Canada when we see inevitable imported cases.
And this is one of the most safest vaccines around. It's proven.
It's been around for decades. Safe, free, widely available, very, very effective. But remember, there's this was a 1999 Wakefield article that falsely linked measles vaccinations with autism. Of course, that was retracted, but we're still reeling from this, and it's over 25 years ago, and we're still reeling from misinformation and disinformation from this particular vaccine. And so I think we have a lot of heavy lifting to do from a medical and public health front in terms of combating misinformation and disinformation. And I think it's also a bigger issue in terms of how we do that in online settings where we see a lot of that amplified. And unfortunately, people see this and sadly make poor decisions for themselves or their family members.